After we do a vitrectomy surgery, what goes in the eye in its place? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist here in Irvine, California. I get this question a lot. It makes a lot of sense, so I think we ought to talk about it. Just a brief review. Vitrectomy is a surgery we do where we remove the vitreous from the eye because it might have a problem in it, like a vitreous hemorrhage or a dislocated lens. We also do it for epiretinal membranes, macular holes, retinal detachments, etc. In vitrectomy, we remove the vitreous. That's the origin of the name of the surgery. Vitrectomy, anything that says ectomy, like cholecystectomy or prostatectomy or whatever, indicates removal of a thing. And in this case, it's the vitreous that's removed. In the process of vitrectomy, the vitreous is removed slowly, and then a device called a vitrector, which is sitting next to the patient, infuses something almost like normal saline into the eye as it's removed. Then in the case of, let's say, a retinal detachment, we'll put a gas bubble inside of the eye to hold the retina flat so it doesn't detach, while the laser that's applied to the retina matures, and then eventually the gas bubble goes away. But what takes its place? What replaces the vitreous in the back of the eye is fluid that is produced in the front of the eye, something called aqueous humor. Aqueous humor is produced by a part of the eye called the ciliary body. The ciliary body has several functions. It's a giant muscle that holds the lens in place. It also inflates the front of the eye, the anterior chamber. That is where the cornea and the iris and all that is. And after a vitrectomy surgery, when the vitreous is removed and the gas is going away, in that case, let's say, then the front part of the eye, producing aqueous, takes over the rest of the eye and fills the whole eye. This is not dangerous. It's not concerning. The aqueous fluid is beautiful, crystal clear stuff. The retina loves it. Everyone's happy. Think of this almost like wisdom teeth. If you have wisdom teeth, you pull them out. It's not like you can't chew your food or something. I'm sure there are complications stemming from that, whatever, but the point I'm trying to make is there are certain parts of the body that you can actually live without, and in fact, parts of the body actually like it, that they're living without it, including, say, wisdom teeth. In fact, if you think about it, the vitreous is somewhat evil in a sense. That is, the vitreous leads to a retinal tear, which then leads to a retinal detachment, for example, in the case of a retinal detachment. So it makes sense. We want to remove the vitreous from the eye, and we're glad that it's gone so it doesn't cause more trouble in people who have that kind of a condition.